This is Jeff Strickland in MOT 136, Introduction to Clinical Skills, and I'll be performing procedure 30-11, removing sutures or staples. We've already set sterile supplies on a sterile field. So we have a Teflon coated gauze, steri strips, forceps, scissors, and sponge forceps, and then some gauze sponges. Off to the side, out of sight, we have triple antibiotic ointment, gauze wrap, some more gauze sponges, paper tape, sterile gloves and non-sterile gloves, and betadine swabs in a dish. And also we have a roll of Copan. So we have assembled the supplies that we needed. We washed our hands and followed standard precautions. I also introduced myself to the patient, Rupert, who we know well by now. Identified him. He gave me his full name and date of birth. And then I explained the procedure that we'll be performing, which is removing sutures. Then I applied non-sterile gloves and removed the bandage and discarded both the bandage and the gloves in the biohazard waste container. I've already opened the suture removal kit and put the necessary items on the sterile field as we saw. So I'm now looking at the sutures. I'm looking to see if they're covered with any dry fluids. And if so, I'll soak that with sterile 4x4 sponge with saline solution. And we don't see any in this case, so there's no need to do that. So now we're going to put on the sterile gloves. Put the gauze pad on the side where I'll be dropping the stitches. In my left hand, I'm going to have the forceps. In my right, the suture scissors. I'm going to lift it up by the knot and cut. Turn these around. And cut as close to the knot as possible. And then pull that over the incision. And then drop it. I'm going to do that for the center one. Yeah, the last fifth stitch. Now I left 2 stitches in there because I don't want to pull them out, so I put some steri strips on to prevent wound dehiscence, which is separation of the cut or the wound. So I'm going to apply the steri strips. Then I remove the remaining stitches. And apply the last steri strips. Now I'm applying some benzoin. And some antibiotic ointment. Then we'll cover it with a Teflon coated gauze pad. Rupert's going to lift his arm for me. Apply some tape to the side there. I'm using paper tape. And we're going to secure that with some coat band. We won't put it on tight. It'll just hold better as it sticks together. And then we'll cut that end. Now we'll dispose of our used supplies and set aside those instruments that we used for sterilization. You can remove my gloves and wash my hands. Then I'm going to assess Rupert's post-procedural stability. Then we're going to document the assessment and the steps performed in the procedure and Rupert's medical record.